Hello everyone. A warm welcome to the presentation of my research for this conference. My name is Mufeeda Kabeer and here I am presenting my research study to you all, Unveiling the Nexus, Role of Extroversion in Self-Care. Let's delve in. Understanding self-care. What exactly is self-care? The WHO defines self-care as activities that individuals, families, and communities undertake with the intention of enhancing health, preventing disease, limiting illness, and restoring health. Previous studies have shown that practicing ongoing self care is essential in maintaining psychological wellness. That is, engaging in self care activities can actually help in lowering stress levels, increase quality of life, and increase experiences of positive emotions. So, how well is self care practiced among the common public? Apparently, a number of studies have been conducted on understanding self care among mental health professionals, but very less among the common public. A survey conducted by the Department of Health in England on 2005 showed that individuals have motivation to feel better and to engage in self care, but lack the knowledge and guidance on how to incorporate self care practices into their daily lives. And this is where us as a therapist can step in. Therapists can actually suggest and promote self care activities among clients. But how do we understand what activities are suitable or beneficial to whom? Different individuals enjoy self care differently. What is self care for me might not be self care for you. For example, I'm a person who enjoys painting and going on long walks for self care. You might have a different list of activities which you enjoy, and these differences can be a part of our personality traits. Previous research has shown that personality traits contributes towards an individual's perception of self care and well being. Understanding your client can help the therapist in you to work with them to bring up a self care routine tailored to their needs. Among the five personality traits of five factor model of personality, extroversion as a trait is one of the widely discussed traits among the common public. Hence, having an understanding of where the client falls in the level of extroversion can be helpful in understanding how they might perceive self care and hence support them in engaging in self care activities. While doing some research on this topic, I found out that previous research shows that extroversion has a strong correlation to happiness, which means higher the level of extroversion in an individual, the more happier they would be. Studies also shows that extroverts prefers to engage in activities which are more social. On the other hand, individuals with lower level of extroversion or introverts has difficulty forming social connections and hence prefers to be on their own company. Some research on well-being suggests that social relationships play an important role in the well-being of an individual. And so this raises a question if the differences in well-being is actually due to the preference of an individual to engage socially. Mindfulness and meditations are some of the widely acknowledged self-care practices within and outside therapy. It is often an individualistic activity practiced within one's own personal space and is so much of an inner process. However, an emerging model called social prescription is used among different healthcare professionals with the aim to enhance the well being of an individual by linking the client with different social services who works together in groups to support the client's needs. From the understanding we gained from the previous slide, would an extrovert prefer mindfulness or a social activity? Similarly, would an introvert be comfortable and benefit from a social prescription? To address this confusion in research, this study aims to understand these differences by measuring personality, particularly extroversion and introversion, against engagement in self care and well being. So, how was this research planned and executed? The study recruited 151 participants through opportunity sampling, through the Bangalore University Student Participation Panel, and also through social media adverts. The participants were all 18 years or above, and there was no exclusion criteria for gender or other socio-demographic elements. The research used an online questionnaire and is purely a quantitative research. The data was analyzed using the method of correlation analysis to understand the relationship between each variables. The measures we used in the questionnaire are as shown here. The research used the Big Five inventory to measure the level of extroversion. It used only the specific six items from the inventory, which specifically measures only the extroversion trait. Well-being of an individual is measured by using the Warwick-Edinburgh Mental Well-being Scale. The level of engagement in different self-care activities are measured using a self-structured questionnaire which had 12 items with a 5-point Likert scale. The 12 items are 12 different activities of self-care. Preference of engagement in each activities, that is alone or within a group, is measured using a self-structured questionnaire with an ordinal scale. Apart from these measures, a text box was provided which asked the participants to fill in the number of hours that the participant engages in well-being or self-care in a week. Now the procedure. The study was granted ethics approval from Bangalore University's Ethics Committee. Following that, the questionnaire was shared with the participants using an online link. Through the link, the information sheet and the consent form were made accessible to the participants. After the participant completed the questionnaire, a debrief sheet containing summarized information about the study was also shared to the participants. After the data collection, the raw data were manually analyzed to exclude any incomplete data, which resulted in a total of 148 participants' data for analysis. A descriptive analysis of the socio-demographic data showed that the mean age of participants were actually 28 and also showed that the 76.71% of the sample population were females. Pearson's correlation analysis was performed to investigate the relationship between personality, well being, level of engagement, preference of type of self care, and the number of hours in a week where they engage in self care. The results showed significant relationships between personality and well being, engagement and well being, and also engagement hours and well being. Let us look into each in detail. First, personality and well being. Between personality and well being, there is a strong positive correlation. That is, higher the level of extroversion, higher their well being would be. This finding is very much inconsistent with the previous studies which was discussed earlier. Hence, it can be understood that the extroversion trait, being more social and more fun going, has some advantages over the introversion trait towards positive well being. And the significant finding was found between engagement and well being. There was a strong positive relationship between the level of engagement and well being. This finding is again inconsistent with previous studies. This finding is relevant to therapeutic practice and provides an evidence base to therapists for supporting and suggesting clients in engaging in different self care activities. This is irrespective of the level of extroversion, which means that both extroverts and introverts would benefit from practicing self care activities. One of the main aim of the study was to find if extroverts and introverts have any preference towards engaging in self-care. Our hypothesis was that the introverts would prefer engaging in self-care alone and extroverts in group. However, the results showed no significant relationship between personality and a preference variable. Hence, it can be said that the differences seen in engagement can be due to other factors, which might be motivation, thought processes, or attachment styles, of the introverts. This understanding is also helpful for therapists to be more empathetic and supportive while working with introverts. Another significant finding was that the more number of hours engaged in self care, higher would be the well being. Hence, engaging in a consistent and effective self care practice would increase positive well being in an individual. So, these are the major findings of my research study. And like any other study, this research also faced some limitations. One of the limitations was that it was difficult to understand what self care was or meant to each participant. That is, the questionnaire measured engagement of the participant with in 12 types of self care activities. However, some participants might be engaging in other activities which is not included in the list, which is self care for them, with or without realizing that. It was not feasible to include all the activities, hence, we chose the most commonly practiced self care activity. This could have been a bias to the results. Another limitation was to identify the knowledge and guidance of the participants about self care practices due to the diversity among the sample population. Another limitation was the difficulty in understanding in what mental state an individual was during the time of the study. The level of motivation at the time of the study and the emotional state they were would actually influence their responses to the questionnaire. And another limitation was an imbalance in the sample population in regards to gender, as 71% of the sample population and the participants were identified as females. It would be difficult to use this result and generalize this result to the general population. Now, the study has a number of important implications. The results showed importance of implementing self-care activities to improve well-being. This understanding can help both the therapist and the clients to support the clients and engage in self-care and to result in a positive well-being. Another important implication is that the study helps unveil the darkness around the differences in personalities and how they impact their well-being. This can also be used by therapists to show unconditional regard and empathy towards their clients. Future research could investigate the impact of other traits of the five factor model of personality and see how they influence engagement in self care. The researchers in future could also investigate other factors which causes lower well-being levels in introverts. And that's it from me. I sincerely hope you find the study interesting and find it beneficial within your practice. Thank you and all the best.